and I am spending some time today with Dr. Charles Whittenburg with Orthopedic Center of Arlington.
Hello.
Hi, how are you?
Good, thank you.
Good. Well, you know, I think for the most part you would agree that most patients don't even realize that they need an orthopedic surgeon until it's already too late. They're already injured, and so I think that for the most part they're seeking out somebody last minute after they've been sent home from the ER. And I know that in your office you actually see a lot of bone fractures. So from beginning to end, how do you treat those?
Well, the patients usually go to the emergency room after just having an injury, and in the ER they'll get x-rays and they'll be told that they have an ankle fracture, for example, and a splint will usually be applied. They'll be given pain medication, and then they'll be told to see an orthopedist. And you know, it usually takes a few days to up to a week to see an orthopedic surgeon. And once they get to our office, we review the x-rays and you know, determine if the fracture or the broken bone is going to heal without surgery, or if they're going to need a surgical procedure. In the case of an ankle fracture, for example, they may just have a non-displaced fracture of the bone on the outside of the ankle, the fibula, and if that's the case, sometimes they'll be able to get by without surgery, and we just put on a cast, and they'll wear that for up to 6 or 8 weeks, and then that's usually the end of it, with a few x-rays in between. In some cases, the fracture is out of position, it's not in good alignment, and the bones are, if they are left that way, they might not heal appropriately, and that's when the surgeon may or may not make the determination that surgery is needed. Surgery for fractures, in most cases, is generally just done to align the bones in an anatomic way and to keep them stable and still for the healing time that's required. And that's usually, in most cases, up to several months. So the surgery involves exposing the bone and then aligning the bones in a more anatomic fashion, and then stabilizing the bone with hardware that's usually plates and screws or rods, and then that stabilizes the break so that the pieces don't move, they stay in the position that we put them in, and then over that healing period they heal and go on to be fully healed. Most of the time the hardware that's inserted is there and it's biocompatible and it's able to be left in place from then on. In some cases, this is rare, some cases the patient or the doctor decides that the hardware needs to come out. But in most cases, the hardware that's inserted is allowed to be left in for long term.
I would imagine that your patient population is quite large with the bone fracture injuries.
We see a lot of that. Most general orthopedic surgeons, that's a significant part of their practice. We take call at Medical Center of Arlington, which is a level 2 trauma center. So we see a lot of car accidents, a lot of falls, a lot of sports injuries, and fractures occur with all of those types of problems. So it's a big part of our practice.
So I'm assuming you are their hero at the end of the day.
Well, most of the time we try.
Yeah, that's a good position to be in.
Yeah.
Again, this is Dr. Charles Whittenburg with Orthopedic Center of Arlington. And please take a look at our Facebook, LinkedIn, and Twitter to learn more. And my name's Elisa with justorthopedic.com.
Thank you.